The 7th of October 2020, the Nigerian government rolled out a 10-year plan of achieving universal health coverage for the poorest and the most vulnerable population in the country. But to date, many Nigerians still lack access to healthcare. Stakeholders in the health sector believe this is because Nigeria lacks the political will to execute it.
From every indicator, we still have poor health indices for Nigeria. And why? It's not because we don't have the plans or we don't have the policies in place, but we still lack political will going forward to push implementation up to the grassroots level. So what we're saying is politicians must take this as a task. The electorate too must start asking questions. If you say you are providing health care for all, what are you bringing to the table? How much of understanding do they have of how the political class or of how the health sector works? So we're looking at issues around implementation of policies within the political class. We're looking at issues that will make better understanding for our politicians, particularly those who are coming up in 2023, why they need to invest in health. Enough of the promise of health, and what we see are just sometimes hospitals that are not operational. And that's not all about health. And for us to build this better Nigeria that we are all aspiring for, we need to have healthy Nigerians that will be at the forefront. If health is not well placed in your manifesto, there's the likelihood that you might not be voted for.
With the 2023 general elections in view, it is believed that only visionary leaders can achieve the much desired change in the health sector for the good of all.
Now that we're going through elections, people should be held accountable. All of us here, or all of you, everybody is a voter. Leaders must tell us what is their plan. We cannot continue to be led by people that do not have an idea of what is required to lead this country forward. People must stand up and say, yes, you want to provide better healthcare for me. How do you want to do it? And let us listen to you. But where people can get away without that, there's no way forward.
The theme at this event is putting health and health security on the political front burners. The consensus here is that to achieve a healthier population, reforms in the health sector must be prioritized. Chinaza, Arise News.
Right, still on health, the Nigeria Center for Disease Control says 434 cases of Lassa fever have been recorded in Nigeria in 2021. The states affected include Edo, Ondo, Taraba, Ebonyi, Bauchi, Benue and Plateau, Kaduna, Enugu, Nasarawa and Kogi, while Cross River, Imo, Anambra, Delta and Abia all have one case. According to the NCDC's recent Lassa fever situation report, at least 80 persons were also confirmed to have died of the disease this year. The agency says following the confirmation of Lassa fever cases in Nasarawa State and the FCT, it has intensified the activities of the National Multi-Sectoral and Multidisciplinary Lassa Fever Technical Working Group for Lassa fever surveillance and response in the country.